The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Ageless Health with yours truly, Dr. Tom Roselle. Got a great program for you today. As always, all kinds of things that we want you to know about so you can continue to improve your health. Remember, that's why I do what I do, is to give you the information to be able to kind of, avoid the drugs, the surgeries and so forth, and not be crazy when somebody tells you, well, you have to live with this the rest of your life. That's not the deal. What we're talking about today is, that ugly pain that runs down your leg. And the other day in the office, I had a patient that came in and they were complaining that their leg was numb all the way down from their hip down to their toes. And it was only one side. It wasn't both sides. So it wasn't a typical neuropathic problem like you would see with a diabetic pattern. But the pain would go from numbness and then in certain positions would continue to get sharp and ugly and so forth. But it had been there for a long period of time. So what does that have to do? So I asked the guy, I said, hey, what have you been doing about it? What were you told about this? Normal thing. When did it first start? How long ago? Was there an injury? Was it an accident? And he said, well, all the doctors I go to tell me that it's a sciatica, except the pain was in the front of the leg and the side of the leg, a little bit in the back of the leg. And it doesn't make sense because the sciatic nerve, and that's what we're talking about, a big long nerve that comes from your back, goes down the back of the leg and a little bit to the outside and then down into the toes, into the foot. So you have to distinguish, one, the direction of it. Most physicians, for whatever reason, left their neurology back in the classroom after they took the exam and they forgot to refer to it again. So if that's the case, then we can't take a diagnostic literally unless it's very specific and it can be explained. And we're going to do that today. Is we're going to explain what that leg pain is that you've been having. And by the way, if you're in the Washington, D.C. area, coming up on February the 18th, Dr. Harlan Browning, who we lovingly call the professor, will be presenting that topic on causes of sciatica. It's going to be one of those things that, you really, if you're suffering from back pain and leg pain, you really need to know what this is all about. More importantly, what can you do about it? Do you have to live with it? Is it something that you're stuck with for the rest of your life? Do you have to keep popping all kinds of drugs, getting progressively more significant over time? The short answer is, in the greatest majority, in over 90%, the answer is no. You don't have to live with anything. These things are reversible as long as you know what the deal is and why it's there in the first place. Somebody comes up with a little butt pain, right, in your cheek, you're sitting on it, and it hurts, it burns, and so forth. You get up and you walk around, and it goes away, and you hate sitting down. And sometimes if you're lying down, it's a problem, and your toes get tingly. And it's not because you're crossing your legs, but it's problematic. So how do you distinguish what is really characteristic of a sciatic nerve pain, a leg pain that just is unremitted, won't go anywhere except bug you? So let's talk about that a little bit. Let's put the pieces together. And as we get into the program, I want to also talk to you about your immune system. And as a matter of fact, it's on top of my head right now. So let's do this. Put this kind of as a benchmark. Go to our Ageless Health store. Many of you have been writing me and calling our office and asking, what can you do to protect yourself immunologically? All the colds and the flus, the retroviruses, the coronaviruses, and all the nonsense that's out there, flu symptoms that we have. If you go to Ageless Health Store, you're going to see me kind of running my mouth a little bit and talking to you about 4 very specific nutrients that I take, my staff takes, my children take, my wife takes, and we don't get sick. So how does that happen? This is one of the things that we take every day, and you're going to see that. So go there, check it out. Go to Ageless Health Store, and we have a site that you can go ahead and order it right online, and the company will send it to you. So we don't often finger point specifically, and you're going to notice it's not just one company. There's about 3 different companies that these supplements represent. So check it out. But I promise you, if you take this stuff on a day-to-day basis, you will upregulate your immune response and probably beat the winter garbage that's all out there. Remember, you got the flu, you got the retrovirus, you got other type of endoviruses and so forth. These guys are no fun, and they can knock you down. And and one is a respiratory virus that gets in your bronchial tubes, and it's pretty ugly. Anyway, go to agelshealthstore.com. Let's get back into the program. So that pain that goes down your leg, what can it come from? Lots of things. You can come from your foot not working the way it's supposed to, meaning you drop the arch on your foot. It's pulling on the nerve roots all the way through. But the first thing that we have to remember is that a sciatic nerve pain is a pain that affects a bundle of nerves, not just one nerve. Sciatic nerve is a term used to describe 5 different nerves, 5. And they come from different parts of your low back and so forth, and into the pelvic structure. So I'm going to show you in a second what it really looks like, and it's important that you understand that. When you have a sciatica, that means that sciatic nerve is being irritated by something. So the thing is that we need to know. So let's get into that just a little bit right now so we can kind of set the stage. So this is a model of a human spine, pelvic structure. Right in the back here, this is called the sacrum. See this yellow thing all the way? That's your spinal cord. And then off of it, you have all these little branches. Those are the nerves that go in different places. But the sciatic nerve starts up here. It starts with the 5th disc space and the 4th, and then it goes down to sacral 1, 2, and 3. Now, the nerves come out as a group, and they exit right here. See where my finger is? Right in that area, about that size too, about that size. And it's called the sciatic, or the sciatic notch, this area here, and then the sciatic bundle. That whole 5 different nerves come out here. Now, what they do is they branch at that point. They go to the side of the leg, they go to the back of the leg, but they don't go to the front of the leg. That's a different nerve root. That's called the femoral nerve. Femoral, front of the leg. This sciatica, back of the leg. So take a look at this structure so you can keep it in your mind as we're talking. I'll probably bring it up again. So this bone that I have my fingers on right here is the sacrum. This bone is the iliac crest, or the ilium, your pelvic structure. This is same thing on this side. Okay. Now, these vertebrae, these bones, lumbar spine, there's 5 of them in through here. They're designed to allow you to move and twist and bend and come back to normal, providing the structure is not compromised, stuck, irritated in some way, and these nerves get trapped. Now, let's get into it, because I want to show you best I can. I wish I had a different model here because it would be much more descriptive. But many of you who've had sciatica or sciatic nerve pain have been told that you have what? That you have a piriformis syndrome. What's that? A piriformis syndrome is a muscle that comes across from this lower part of the sacrum, this bone sacrum, and comes over and attaches into the hip bone, which goes right into here. Now, the sciatic nerve comes out, and often that nerve can compress, compromise, irritate because of the muscle not working the way it's supposed to. In some very rare conditions, genetically, the sciatic nerve, instead of going above or below it, goes through it. Doesn't happen too often, so that can be problematic. But here's what goes on. Can that sciatic nerve be irritated because the piriformis muscle is not working properly? The short answer is yes, it can be. But it's because the muscle now is not holding the sacrum and the pelvis in the position that it needs to. So when it becomes weakened, and it's usually a weakened muscle, not one that's in spasm, that allows this whole complex to move apart slightly, millimetrically. It's called a subluxation pattern, and it causes irritation on that nerve root. And now you got pain someplace, and it's going down your leg. It may go to your toes, and you wonder, where's it coming from? It may be right there because of the piriformis muscle. Now, we're going to get into this a little bit more, but I want to show you the structure. Have you ever been told that, well, you have spinal stenosis? That means that where the nerves come out here, this canal, this hole, gets smaller. And it gets smaller because the disc spaces shrink. They get like this because they've been damaged over time. You don't drink enough water. We're going to talk a little bit about those things in a second. And or they're stuck and there's no motion. If there's no motion, the disc spaces, these guys are like sponges, and they suck the fluid from the surrounding environment, but particularly from the blood vessels that go to them. So if it's locked, it can't do its job, and they begin to get hard and they begin to shrink down. So those are a couple of things that we're talking about. So we can have a spinal stenosis, we got muscles that aren't working, or we can have an ugly thing like this. You see that big red area here? That's called a slip disc. It's a protruded disc. It's a herniated disc. It doesn't have to be big like this one. It can simply be just a little bubble. So let's talk about those three things today. Let's talk about slip disc. Let's talk about spinal stenosis, and let's talk about piriformis syndrome. And I may throw a couple extra ones in there as well, but think about that because those are the most common. So as we try to evaluate a pain pattern, we have to understand that it can be coming from a lot of different things. Remember, in my world, if you've been listening to the program, we talk about the relationship between organs and muscles. So what happens if an internal organ system is not doing well? Often it reflexes back to the spinal system, and then it goes to the nerve root that goes to a muscle someplace. So that nerve can be loss of function. That nerve can be painful. That nerve can be one that produces numbness because it's not working the way it's supposed to because it's being crushed. But you have to determine which is which. So here's a couple of differentiating problems. If you have leg pain and you're at home and you have a partner with you and so forth, lay flat on your back and then have them gently on the side of the leg pain, take your foot and raise it, not just your foot, but your leg. You got to keep your leg straight. Slowly bring it up. And as soon as you feel pain, tell them to stop. And because what you're doing is you're stretching the nerve over something that is causing it to be a barrier or something that is a barrier to that nerve root, right? All right. So what that indicates often is one of two things. It's either a spinal stenosis problem or it's a slip disc. And that's how you can tell. And usually you're going to feel that pain within about 6 inches of taking it off the bed if you're laying flat on your back. Now, you're flat on your back. You're lifting your leg up just a little bit. You're not doing it. Your partner is. It's a passive motion. So this is how you can diagnose what might be going on. If that gets your attention, where pain shoots down your leg or it gets really sharp into the pelvis, into the hips or whatever, that is suggestive that you may have a disc that's bulging, a disc that's protruded, a disc that is not in the position it should be. Now, it also can be spinal stenosis, and it depends on where that lateralization is. So I'll give you another one, right? If you're standing up straight and you said you don't have any pain, it only hurts when you bend forward. Have somebody get behind you and hold your hips together. So where you're going to hold, let me get my friend here again. Where you're going to hold is this person's going to stand behind you. This is you. And you're going to put your hands, this person's going to put your hands here and just put pressure into the pelvic structure. It's kind of, you're going to be around like this. You're going to hold it like this tight, and you're going to put pressure into it. And then you're going to bend. If the pain worsens in your leg or shoots in your leg holding the pelvic structure, it tells you it's coming from the spine. If it gets better by bracing it, by holding it together, it tells you that it's coming from the hips. Cool, right? So you can differentiate it immediately where it's coming from. Now you can get much more specific by testing the muscles of the area. You can get much more specific by doing other neurological testing. If you can identify the structure, you can fix it. So in my world, if we look at a spinal system that has narrow disc spaces, whether it's from spinal stenosis or the disc is beginning to shrink down, if we have muscles that are not working the way they're supposed to, they're inhibited. By the way, you know, when you have a muscle spasm, it's generally because, or muscles too tight, it's generally because 80% of the time, that's a lot more than generally, 80% of the time, it's the opposite muscle that's weak. Do you hear me? 80% of the time, it's the opposite muscle that's weak. So if you look at somebody, you know, I'm going to kind of sit up so you can see it, right? So let's say that my my shoulders, you can see this side is up a little bit, right? So I'm going to just use that one like this. Now, why is it up? This is going to be tight and it's going to be stiff. I'm not going to be able to bend it the way I'm supposed to. Why is that up? Because there's a muscle here, the big latissimus muscles, the side muscles, the bat wing muscles that you see these big weightlifters do. It holds the shoulder down and back. Now, if it holds it down and back, then you've got pretty good range of motion. You can turn your head. There's not an issue with it. But if it comes up like this, now you're restricted. The same thing goes with any muscle, even if it's in the pelvic structure. The pelvis works the same way. So if you have a front muscle, your thigh muscle, which is called your quadricep muscle, if that's not working the way it's supposed to because it's weak, then the muscle behind it, called the hamstring, is going to be too tight because they're a balancing act. So what do you fix? Do you fix the too tight muscle or do you fix the one that's inhibited? 80% of the time, you have to fix the weak muscle or the problem never goes away. It's the inhibition, the weakness in the opposite muscle, the balancing act, that's causing the other one to be a problem. So we're going to get into this in depth today and really kind of pick the pieces apart. I think that you're going to really be surprised, if you will, of what causes a lot of these leg pains, these sciaticas, if you will. And they can be anything from, as we said, a disc that's not in position, bulging, protruded, slipped, if you want to use the vernacular. It can be a canal where the nerve's coming out of and it's crushing that nerve root. We're talking about things that happen to all of us: muscle weakness and inhibition. And remember, I said at the start of the program, I said you could have a flat arch in your foot because it drops the entire leg and everything on that side. So begin to look at you. Get in front of the mirror and see what you look like. Yeah, I know sometimes it's scary, but I do the same thing at this point in my life. So see if the shoulders are level. If you have one up like this, I'm doing this purposely, right? I'm bringing it up and showing it to you. So this one's down. That's not normal. They need to be like this. They need to be balanced out properly. What happens if they're not? It tells you something about the body. Look at the hips. Remember I said they give you 2 easy tests to do at home if you have leg pain. One is what? Have somebody gently raise your leg up slowly. They do it too fast and you got sciatic pain, it's going to fly down your leg and you're not going to like that person very much. So as soon as you start feeling pain, say, I got a problem. Okay, so now you have to identify where it's coming from. It could be spinal, it could be pelvic structure. So what did I tell you to differentiate it? So here's the deal. Now you can bend forward with somebody holding your hips together. If the pain gets better, it tells you it's in the pelvic structure, it's sacroiliac or something of that nature. If it gets worse, it tells you that it's coming from the spinal system. So you have a lot of different ways. So I'll give you another one right now while we're in the program. Then I'm going to break these down. I'm going to tell you why as we go through. If you get up on your toes, or you try to get up on your toes, and you can't do it, it's weak, or it hurts you when you do it, that tells you it's the lower part of your spine, just like this. Let me show you again. So this last disc space right here, there's a nerve that comes out that allows you to get up on your toes. If you can't do that well, it's a problem at that segment. Then try to get up on your heels. If you can't get up on your heels, it's the next one up. It's this guy. And often a combination of other things. But that's how you begin to differentiate it. When did you go to the doctor? And when did they do those things for you? How did they identify? How did they say, well, you got leg pain, you have sciatica? Not necessarily. Remember, we already said that the back of the leg is the sciatic pain, the front of the leg is the femoral pain, and then there's differentiating pieces around that. You have to understand where it's coming from to be able to fix the condition. You have to be able to see those pieces very specifically to be able to affect a proper resolution of the condition. So I give you a whole bunch of stuff. We're going to break those down a little bit more as we go into the program. I'm going to give you some things that you need to do. And we're coming up to a break in just about a minute here. But I want you to remember that if you're your own diagnostician, if you spend the time really understanding how your body works, you can resolve most of the stuff. And you can hold your physician, your healthcare practitioner, responsible for understanding what it is that they're telling you to do and not just throwing medication at you. Because the majority of times, it's not about the medication. The majority of times, it's about what's happening in your body right now. And you have to understand it. You're the best doctor, not anybody else. We're coming up to a break. listen, don't forget to go to Ageless Health store on our website. There's a lot of different things there for you, but I got a lot more information for you today, things that we're going to cover that you didn't know about, I promise you. Don't go away. You're listening to Ageless Health with Dr. Tom Roselle. Stay right where you are. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellcare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use, so I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com. Hey, everybody, welcome back. This is Dr. Tom. You're listening to Ageless Health, and we've got a program that I'm giving you ways to diagnose yourself. What are we talking about? We're talking about leg pain called sciatica, but it's pain that is down the back of your leg, into the side of your leg, and into your foot, not pain that goes down the front of your leg or the inside of your leg. That's a different type of pain. That's called femoral nerve pain, not sciatic nerve pain, femoral nerve pain. And what did I tell you about the sciatic pain? It's 5 nerves, right? It's not just one. It's a bundle of nerves that come out where you're sitting down, and it comes out about the size of your index finger, or mine anyway, and it's broken up into multiple segments, and depends on which one's irritated, depends on where the pain is in your leg. So we gave you some things to look at, and I told you, check this, check this, check this. So here's the deal. So if you got this pain, and we're starting to differentiate, we realize that leg pain is not just leg pain, it's not leg pain. It comes from different places. So if somebody goes in, you go see your doc or some guy that's out there doing decompression syndromes and spinal neuropathies and so forth. Ask them the question, which segment, not based on x-ray, but based on their examination, which segment of your spinal system is actually involved? So I gave you things right now that most of you now know more than what your doctors know, because they don't know how to differentiate it. So what does that mean? So I told you what? Lay it flat on the bed. If you got leg pain, it's like crazy painful, right? If you're laying down, it's not as bad. Have your partner, have somebody with your leg straight. Don't try to bend it. Just gently begin to lift it off the bed slowly. Don't do it more than about 5-6 inches. But as soon as you feel the pain, say stop. Okay. Now, if that's the case, if that's the pain threshold, it goes down the back of your leg, it's burning and so forth, it begins to tell you that you have a spinal problem someplace, more than likely. It could be stenosis, right? It can be a slip disc. It could be some other things. Now, that's step one. Step two, get up on your feet. Have somebody, if you're in a lot of pain, get up and stand up. So here's the deal. Now, I told you a couple things. Walk on your toes. If you can't do it, that's the last disc in your low back. Walk on your heels. If you can't do it, it's the one above. It's lumbar 4 disc space. Okay? Now, we want to see where it's coming from. I want you to bend forward, too. Bend forward from your waist. If you can only go, let's say, I'm making this up, let's say 15 degrees, 20 degrees. Now, the next thing you do is you have somebody get behind you and they put their arms around your hips and they hold you. They brace you, not hard, but just like a girdle, okay? You want to hold it like this. And then you're going to try to bend forward again. If the pain gets much better, it tells you that it's in your pelvic structure. It's a sacroiliac problem of some sort. If it gets worse, because now you have more motion in your lumbar spine and the low back spine, that tells you that it could be a disc problem, but it's in the spinal system. It's not there. So we have a lot of different ways of differentiating exactly where it's coming from. Instead of saying, let's go out and do this MRI, this CAT scan, this thing, that thing, we can do things much more specifically. How about testing the piriformis nerve? We started out talking about the piriformis syndrome, and not the piriformis nerve, but the piriformis muscle. If you test it properly, the muscle will show up generally inhibited 80% of the time. So that means it's weak. So if you have a weak piriformis, the next question comes again, where is it coming from? The piriformis has a nerve. One of the nerves is what? It comes from that last disc space. So you're already beginning to differentiate one piece over the other. Tell your doctor, where's it coming? Or ask your doctor, where's it coming from? Tell me what we have to do to fix that. Why is it coming from there? Anybody treating structural problems should have the capacity to be able to differentiate those issues and explain to you what the options are relative to getting it done. Not saying, well, we're going to inject it with steroids called Depo-Medrol injections. I don't think so, because you can only do 3 of them anyway. And what do? They decrease the inflammation with the hope that breaking that pain cycle will be enough to resolve it. Generally, they don't work. Sometimes they do. Sometimes they, oh my God, this is a miracle. It works really well, but then only for it to return within a short period of time. And then your doc says, I need to send you to the surgeon. We have to see if there's something else that needs to be done there. I don't know about you. When my patients come in, when they come into the Roselle Center, I got guys that think and talk like I do. And they're going to watch you. They're going to look at you. They're going to ask you questions. How about the doc that you go in and say, I got leg pain. He's got 5 minutes to spend with you. He says, take this, let's wash it. Let's see what happens. I don't think so. How about spending the time and really diagnosing the condition? Is it a disc problem? Is it a muscle weakness? Is it a spinal stenosis? Is it a structural imbalance? Now, I'm sitting cockeyed in my chair right now. So a lot of you are looking and say, well, doc, your body's all screwed up. Yeah, it's because I'm getting comfortable and I got my chair shifted over to the side so I can stay in front of the camera and things of that nature. But if I sat up straight the way that I should and I go like this, now everything kind of goes away, right? So that's the laziness on my part. The problem is with laziness like that, like I just showed you, you can end up developing a deviation in the spine that will cause the disc to bulge, that will put pressure on the nerve root, that will send that pain down your leg. So we have to catch ourselves. We have to make sure that we do exercise. I don't know how many of you get on social media sites, but all of a sudden you see all kinds of the first of the year, right? They're talking about, doing these kind of exercises and chair yogas and Tai Chi yoga and all those things. They're trying to get you to move and do something. And how many of us sit and do nothing? That's the problem. And we're getting overly fat. We're getting very stenotic, meaning we don't move our body at all. There's no motion. There's no capacity. So is it any, guess that something's going to happen at some point? I can tell you yes. After, almost 5 decades of practice, seeing thousands and thousands of patients over the years with conditions that nobody seems to be able to identify, we look at them differently because we want to try to understand why is that. Sciatic pain is no different than any other pain in your body. It's not one that has to be cut or injected or take these pills for the rest of your life. It's identifying the issue and then being willing to doing something about it. And that's the key. More than anything else, that's the key. Look, if you come into a doc's office, you come into our office, you see one of my brilliant guys, and on the 18th of February, Dr. Howland Browning and I, we're going to tag team you a little bit. I'm going to let him have the stage for the most part. I'll be sitting there as backup support. And we're going to be talking about this condition. We're going to be talking about low back pain. We're going to talk about leg pain. And we're going to be differentiated between what type of pain it is, how you can identify it, where it comes from, the organ muscle phenomena that's there. All those pieces are incredible. So if you'd like to join us, we'd love to have you there as our guest. Real simply, just go to rosellecare.com or drtomroselle.com and register. And that's all we ask you for. Just register. Let us know you're coming. If something happens, you can't make it, guess what? Call us so we can make room for somebody else and say, hey, listen, something came up. I can't do it, but do it like a day before, so we can get on, the reserve list, the waiting list, and get somebody in. But I promise you, if you've never heard Dr. Browning present, this guy's a genius. I mean, he's amazing with what he does. And he understands the intimacy of rehabilitation. He understands how to put things back together the way they're supposed to. I'm blessed. I am truly, truly blessed with a group of people who are amazing, incredibly amazing, and with their ability to pick things apart and do a diagnostic. And then you have an option, right? You can take the information and make some changes in your life, and let's see what happens with that. You have the option of saying, hey, doc, how do I handle this? Can it be resolved? Should I get an examination? And then, we can walk you through it. If you're not in our area, by the way, this isn't just not about us. This is about you. This is about finding a way to help you help yourself. Say, hey, Dr. Tom, I live in wherever. Is there anybody in my area that does your kind of work? And I'm going to say, yeah, let me see. And by the way, I'd never refer you to somebody that I wouldn't send my own family to. And that's the important piece. I don't do things like that. Not just because I want to send you out. I want to make sure that you're getting the right care, but also educate you so you're getting. And here's the deal. Docs sometimes hate when I send people out. Why? Because by the time I send you someplace, you're educated, like I'm educating you right now, and you ask questions. And it's important that they are able to answer the questions. You can call me back and say, hey, you sent me to the wrong guy. I couldn't answer my questions. But if I'm going to send you there, they're going to you're going to answer and ask the right questions as you should. So here's the deal. If you have sciatic pain, what can cause it? Now, I talked about a couple of different things. We talked about stenosis. We talked about muscle weakness. We talked about slip disc. We talked about that weakness could come from imbalance in the pelvic structure. What else can cause that pelvic structure to be misaligned, ultimately causing muscle weakness or compression on that sciatic nerve? Guess what? Your TMJ, your temporomandibular joint. Every part of your body works with every other part of your body. Your left shoulder, if you will, works with your right hip. Your right wrist works with your left ankle. Your temporomandibular joint works with your sacroiliac joint. So if this isn't working, then pretty soon your pelvis is not going to work either. And it can go both ways. So if we have a misalignment of the pelvic structure, it can cause a problem with your temporomandibular joint. Say, how does that happen? My dentist never told me that. Unfortunately, there's a lot of dentists that don't get it. There's guys out there that understand it. They're called, neuromuscular dentistry. And there's two competing groups. One's called Pankey Institute, and the other one is called Las Vegas Institute. And these guys get it. They understand how this cranial plate, these TMJ, these temporomandibular joint patterns affect the rest of the body. So let's kind of go back just a little bit, because I really want you to understand this leg pain and that you're not stuck with it. There's so many people, I don't do anything anymore. I said, why? Because my leg's hurting me. Why is your leg hurting you? When did it start? When was the very first time? How did it come about? If those questions aren't being asked, then your healthcare practitioner, in my opinion, is dropping the ball. They need to know when it first started, what was the circumstances around it that took place. Were you lifting something? Were you out of shape? Did you go for a run? Were you on a bike? Did you go for a mountain, a mountain climb someplace, out in the Blue Ridge in the Washington metropolitan area, and you slipped? You just slipped a little bit, and then all of a sudden, this thing got worse and worse and worse and worse over a period of time, but nobody connected the dots because you kept medicating it with, one of the NSAIDs, Advil, Tylenol, something of that nature. And you could keep it under control. But then over time, because you ignored it and you thought that was the deal to keep it under control, and everybody has this kind of thing, that you let it go. Just because it's common doesn't mean it's okay. Just because it shows up doesn't mean you should be stuck with it. If you diagnose the cause, why is it? Injury, biochemical irritation, constant ongoing stress patterns. Those are the only three things that cause anything. Whether you have back pain, you have cancer, by the way, they're all included in the structural, chemical, emotional platform. If you identify what happened and you fix the thing that caused it to begin with, it goes away. It gets better. But you have to take responsibility for making sure you ask the right questions. If you don't ask the right questions, then you're going to be treated like anybody else. Here, take this. Let's watch it for a period of time. If it gets worse, then I'll send you to whoever I'm going to send you to. That's not the way you should be treated, ever. This is Dr. Tom Roselle with almost 5 decades of treating patients. It's important that you become your own diagnostician, or at least hold your healthcare provider to that quality of diagnostics. Ask the right questions. We talked about a lot of things today. We really did. How about, bending over and bracing the pelvis? If your pelvis is the problem, when you bend over and you hold the pelvis together so it can't move, the pain gets better. If you bend over and it gets worse bracing the pelvis, it tells you it's in the spinal system, not in the pelvis. If you can't walk on your toes, it tells you it's the L5 disc space. If you can't walk on your heels, it tells you the L4 disc space. If you lift up your leg slowly, guess what happens? There's either pain or there's no pain. If there is pain at that point, then it tells you, we got a problem coming from someplace further up, probably in the spine itself. There's another piece of that puzzle. When you find the pain, you bring it up a little bit. If you take the foot and you bend it towards your knee, just the foot, nothing more, and the pain gets worse, that tells you that you got a disc, that there's a bulge, or at least a very significant spinal stenotic pattern. So you begin to narrow down the options. If you narrow down the options, you can fix it. Then you can talk about, the rehabilitative process, spinal stenosis. You look at the chemistry. You look at all those pieces that would finger point to why this thing started. But if you fix those and you change the patterns that produced it to begin with, it goes away and you got your life back. Leg pain and back pain are two of the most common things that everybody at some point of their life seems to be exposed to. Sometimes it's transiently, sometimes it's ongoing. But if you understand structural balance, biochemical balance, and I'm not talking about the level that I do, but understand the things that I'm telling you right now are things that you can wrap your head around without any trouble whatsoever. So if that's the case, listen up, man. You got to start You got to educate your docs. You got to educate the people that are treating you, and not just do it because of the white tower attitude. It's just because they went to school. It doesn't mean that they know all this stuff. They probably parked it after they took the exam, and said, well, that's not what I do. And now with the advent of AI, oh my God, right? They put things in, you come up with a host of possibilities, and they say, well, let's take this and see if it goes away. I don't think so. I don't know about you, but not the way I'm going to treat my family. Listen, there's so much that you can do to help and protect yourself. And if you have sciatica, leg pain down the back of the leg, not the front of the leg, into the foot, there's a reason that it showed up. If you can find the cause, you're good to go. Look, we're coming up to that place where we're going to have to take a quick break. But I've given you a lot of data, a lot of information. And I'm going to give you some more. We're going to kind of tie this all together when we come back after the break. But that's why we're here. Don't go away. I'm going to give you a whole lot more. I know it's like, drinking from a water hose, but nevertheless, that's what I do for you. You're listening to Dr. Tom Roselle. This is Ageless Health. Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use. So I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Red wine is high in a substance called resveratrol. The so-called miracle molecule found in red wine might help improve mobility and prevent life-threatening falls among older people. Mobility problems are particularly common among older people who have Parkinson's disease and other age-related neurological disorders. The research says that this important finding could lead to the development of a natural group of products designed to help older Americans live safer and more productive lives. But before you stock up on red wine, Dr. Jane Kavanaugh says that you can get this naturally occurring substance in larger and pure amounts through dietary supplementation. Red grape juice, red grapes, blueberries, and nuts supply the same amount of resveratrol as red wine. If you're trying to stay upright, do core training exercise, eat your veggies, take resveratrol supplements, and drink red wine in moderation.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Hey everybody, welcome back. You're listening to Dr. Tom Roselle and Ageless Health presentation. Give you a lot of data today, a lot of information, things that you can do yourself to be able to diagnose that leg pain that we call sciatica, and more importantly, where's it coming from? I can tell you a couple of things. I want to wrap up the program giving you some bullet points that you really need to be aware of, and I'm going to kind of go back and again recheck. But before I do that, I want to encourage you, by the way, and remind you that, we're in a lousy flu, cold, ugliness season right now. And a lot of people are getting sick. And my family doesn't seem to get that done. And so many of my patients stay pretty solid. Why is that? Well, I've been asked, what do I take to keep myself going, doc? So if you go to our Ageless Health store, and it says agelesshealthstore.com, or go to drtomroselle.com or rosellecare.com, you'll find our Ageless Health store. Go into it, and you're going to see me running my mouth a little bit and talking about 4 supplements that we encourage our staff, our patients, and my family and myself to take. I take them every day. And fortunately, it's been like forever since I've had any problems. So do they work? I can tell you that they upregulate your immune response and you give you better protection. So check it out. Yeah, there's a lot of other things there. I do it for you. I do it because these are things that I recommend to my own family. I would never recommend anything to you that I wouldn't take or my family doesn't take or that we don't advise our patients to take. So go check it out, agelesshealthstore.com. Let's get back in and wrap up the program a little bit. We're talking about leg pain, sciatic pain. There's a lot of reasons that these things show up. I want you to bear in mind that in any condition that you have to look at the structural pieces of what's not working the way it's supposed to. Was it injury? Is it postural patterns, maladaptations, things that have taken place? Our environment, right? Then we go to the biochemistry, the bioelectrical, all those things that are outside the body, things that we shove into our face that we know that we shouldn't be putting in our body. We know that American food, for the most part, is really bad and poisonous. Europeans won't allow it over there. Thank God for Kennedy's group. They're starting to change a few of the things from vaccines all the way through. And you're starting to see a little better response. They've gone from the mandatory 76 vaccines from birth to 18 years of age down to a couple dozen. So that's a start. It's a good start in the right direction. And, we're looking at how the things have to change relative to our food. They promised us that they're going to take the pollution. If you look at the inside of a grocery store where all the box stuff is, take a look at the boxes and look at the biochemistry set that they've put into that system. It doesn't happen anyplace else except for this country. I will provoke you to ask the question, why? Why is it that way here and it's not that way anyplace else? Why is the United States at the bottom of the hit list when it comes to wellness opposed to other countries around the world? It means that we're doing something wrong. Comes to all kinds of pain problems as well. Why do we have more types of problems like sciatica and herniated disc and chronic pain patterns and immune responses and things like that? Why is that? Why are we stuck with those things in a country that should have the best of everything? Well, I think we lost our way along the years that have gone by, and going back maybe 70 years ago, 75 years ago, after World War II, when everybody started coming home. And we start seeing trends of increasing fatness. When I graduated from high school, I was looking at some pictures the other day, and everybody was pretty lean. There's a few guys that were a little heavier than they should be. And they were either in shape, they were heavy, but they were really muscular. We don't have the height and the size and the girth that, a lot of these young kids do today, but we were solid. But as time went on, we started seeing more sickness. But more importantly, to the topic that we're talking about today, we were seeing more pain patterns, more leg pain, more arm pain, more neck pain. Where's it coming from? Why? Why suddenly are we one of the most debilitated group of people on the planet? I think that we have to first answer that question and then begin to take actions. But in the meantime, when we have the pain, what can we do about it? You come into me as a patient, I'm going to tell you to do certain things and change different lifestyles. Because if I can finger point that's where it's coming from. I'm going to look at the chemistry. I'm going to look at the body balance and the spinal misalignments, the pelvic misalignments. I'm going to look at your feet. I'm going to look at the way you walk. I'm going to listen to the way you talk. I'm going to listen to how you hold yourself. I'm going to listen how you talk to get signs of stress patterns that you're swallowing. Let's kind of put it in an interesting way, right? So we're looking at all three of those pieces. Look, there's very little that's going on with you unless you have one foot on the banana peel, the other one in the grave hole, that you can't make a whole lot better. Sciatic pain is one of it. You don't have to suffer with it. Unless you've got a completely herniated, blown out disc that's crushing and sitting on top of that nerve, which, by the way, happens but is rare compared to all of them, you can reverse this thing if you want to get it done. Stand up in front of the mirror. What do you got around that belly of yours? How much extra shouldn't be there? Bend forward a little bit. What's your range of motion? Can you get down past your knees? I don't know. If you can't do that, that tells you that mechanically something's not working the way it's supposed to. Walk, get your feet wet, and then walk on the floor or on a piece of cement or something, and see if your feet look equal relative to the imprint. If they're not, then your arches are probably dropped down, and you got a problem structurally. Your base of your body is not holding you together. Give you all kinds of diagnostics, lifting your leg off the bed, have somebody lift it gently, keeping your leg straight. Stop as soon as the pain happens, and then push your foot towards your nose a little bit. If it makes it worse, it tells you that you may have a disc that's pressing on the nerve, or what? Or you may have spinal stenosis. Stand up, bend forward. Stop where the pain begins. Then have somebody brace your hips. If you go further down, it's in your pelvic structure. If it gets worse, it's in your spine. Look, if you understand where these mechanical pieces originate, then nobody can tell you anything differently. Nobody can tell you it's, your immune system. Nobody, it can be, by the way, but it's generally not that. But it's structural, chemical, emotional. When it comes to leg pain, sciatic pain, remember, back of the leg, down the back of the leg, side of the leg, into the foot, not the front of the leg, not inside the leg. That's a different nerve. Sciatica is what? 5 nerves. We're recapping, right? 5 of them. They come together the size of your finger. They then go different places, but you have to be able to differentiate which one. What do? Just, kind of hit it all? No, you can be really specific, but you got to find out where it's triggered from. If you can do that, if you can find the triggering mechanism, if you can finger point to the problem, you can resolve this thing. You don't have to live in pain. Don't forget, coming up, February the 18th, I'm going to have the pleasure, as I always do, of co-hosting with Dr. Harlan Browning, the professor. We're going to get into this and we're going to talk about it. We're going to demonstrate. We're going to show you what happens. And we're going to show you how you can make it a whole lot better. So join us. Seriously, join us. Call us. Go to rosellecare.com, rosellecare.com, or drtomroselle.com, and sign up. Say you're coming. And the only thing we ask you that if something comes up that you can't do it, give us a call. All right? It's at 6 p.m. It's a Wednesday night. The weather's getting better. We're going to get through this craziness that is hitting us right now with this snow that's coming down our tail. But guess what? It go away. And by the time the 18th comes around, we're probably not going to have anything. It'll be sunshine and blue skies and the things that metropolitan Virginia, North Carolina, and all of us are normally familiar with. But seriously, join us. Get rid of the pain so you get your life back. Get rid of the low back problem that you have. We're going to talk about that other kind of pain, by the way, that goes down the front. We're going to talk about how it hits your feet. We're going to talk about that knife-like pain that you have in your low back. We're going to talk about all those things. But more importantly, we're going to demonstrate where they're coming from. How can we do that? Because you have to look at the mechanics of the body and how they are interrelated to one piece and another, one system and another, one activity and another. If you begin to differentiate those and you take the time, then you don't have to take the drugs. You don't have to do the surgery. You don't have to live with it. Let's put the fire out. Let's get it done. Let's make sure that you have your health back. Health is your choice. Unless somebody hits you in the head and knocks you out, most everything that we go through in our lives is resolvable. Most everything that we do is fixable. Wouldn't you like to get fixed? Wouldn't you like to turn things around? Or you just kind of got an attitude of, it is what it is. And, I have to put up with it. What do you expect from my age? That kind of silliness. I don't know about you, but, I'm trying to figure out how to get another 35 years, 40 years out of this planet before I leave it. But I want to do it with the ability to be able to do everything that I want to do on an ongoing basis. Wouldn't that be cool? You can do it at any age. You just have to have the right headspace. You have to be able to put the pieces together. Make sure you join me. Go to drtomroselle.com and check out our social media sites. Follow me everywhere you want. I promise you'll get more information on an ongoing basis than anybody else, any other place. And as I said, check out our Ageless Health store. Lots of stuff there that we use all the time. And I don't put anything on there, not just because somebody's wants to write a check. We don't do that. We don't do that. I put things up there so you can pick the best quality of the things that will make a difference in your life and that of your family. But we're going to be here every week, bringing everything together on an ongoing basis, giving you different pieces of the puzzle so you can apply them, not just listen to me for one reason only. Not only you deserve the information, but I truly love you all. You have a great day. See you next week. Bye.